Think of a patient with a family history of extremely high cholesterol. He is genetically prone toward deadly cardiovascular disease. His body cannot handle LDL, or bad cholesterol, as it should. So his LDL levels are much higher than those of his peers. Because his LDL is so high, he's not the typical cholesterol patient. And the typical medications, known as statins, don't lower his cholesterol enough. So his doctor may tell him to change his diet, exercise more, and continue taking his statins, in addition to a new medication known as a PCSK9 inhibitor. This treatment could reduce his bad cholesterol by as much as 60%. But getting a PCSK9 inhibitor will not be simple. This patient may have to wait while his doctor first completes the health plan's prior authorization process. This means detailing the patient's health, diagnosis, and treatment history, and perhaps proving that he has failed other treatments. Some prior authorizations require pages and pages of documentation. The process delays a patient from getting the medication his doctor has prescribed, sometimes for several months. And even after a doctor completes the prior authorization, the patient may still be denied coverage. Why do health plans make it difficult for patients to get the medication they need? Like many innovative treatments, PCSK9 inhibitors are expensive. But rather than find a workable solution, health plans are using prior authorizations to limit access and lower costs. They reject as many as 3 out of every 4 patients who are prescribed a PCSK9 inhibitor by their doctor. The effect on patients can be devastating. Without treatment, a patient's high cholesterol goes unchecked, making him vulnerable to heart attacks, strokes, and even death. To allow patients to lower their LDL cholesterol, improve their health, and protect their lives, policymakers must find a way to resolve cost disputes and provide fair access to the breakthrough cholesterol treatments that patients need.